Hello and Assalamu alaikum. This is the endo mode of the patient that you had requested. The area of interest is the lower left 6 and 7. This is the sagittal view of the teeth. Here we can see that the root canal treatment has been performed. On a transaxial view, this is the distal canal, but we move on to the mesial canal first. In the mesial canal, we can see that mesial root, basically we can see that the root canal treatment has been done. There do seems to be voids present in the obturation. However, the obturation is approximately 2.3 millimeters short in the mesio-buccal and the mesiolingual roots. There does not seem to be any periapical radiolucency, and we also do not see any signs of any major cracks. However, moving on to the distal root of this tooth, which is the lower left first molar, we can see that there is a small void present, but at the same time there is a discontinuation in the root filling material. There doesn't seem to be any major radiolucency, but we do see a slight periapical hypodense area on the transaxial view of this tooth. Moving to the axial section, here we can see this is at 75 micrometers. There seems to be a slight shadow that we see on the distal aspect of the mesial root associated with the mesiolingual region right here. I'll zoom it in for you. We don't know the clinical correlation of the patient is having any symptoms or if there is anything, but if we correlate this particular area with the transaxial view, so we don't see anything major, but we see a slight radio lucency associated in the axial section with this particular area. Moving to the lower left 7, this is the lower left 7. We have this tooth has not been treated for any root canal. It has a restoration which shows slight leakage in secondary caries. The pulp chambers appears to be normal. We have a mesial root with two canals. The mesiolingual canal seems to be slightly more visible as compared to the mesio-buccal canal. The working length of this tooth is approximately 20 millimeters in the mesial canals, whereas in the distal canal, this also seems to be does not seem to have any major radiolucencies associated with it. In the distal canal, we can see that the working length approximately is going to be 21 millimeters. Moving to the axial section, here we can see that the mesio-buccal canal seems to be very sclerotic and does not seem to be very open, but the mesiolingual canal is quite visible. So navigating through the mesio-buccal canal is going to be slightly difficult if a root canal treatment needs to be performed. There is a distal cavity in this tooth, which can be seen on this area, but nothing significant can be seen on the CBCT. If there are any further questions, please feel free to reach to our team. Thank you very much.